Joni Whiting.
Daughter.
And
This is a picture of my
can you just make sure you speak into the microphone? Otherwise we can't hear. And please introduce yourself first and then continue.
This was my daughter before she was diagnosed with her cancer. Oh, I apologize. My name is Joni Whiting, Joniwhiting.
Thank you.
And for my speech, these are the pictures of my daughter in the 89 days that I'm going to speak about in my testimony today. I appreciate the opportunity to be here today so I can share my family's story. More specifically, I am here to tell the story of my daughter Stephanie, a hard worker, loving wife, and amazing mother of 3. In June of 2000, at 24 years of age, Stephanie was diagnosed with melanoma skin cancer on her face that developed during her 3rd pregnancy. The next 2 years were filled with experimental therapies and endless surgeries as they cut her face off 1 inch at a time until there was nothing left to cut. The pain she was experiencing was unimaginable, and a nausea so severe that it became difficult for her to eat. That was when an oncologist at the hospital pulled me aside and told me that Stephanie might benefit from using marijuana. At the time, we did not consider that as an acceptable option. I was strongly opposed to its use. I was afraid of the consequences associated with marijuana's illegal status. After Stephanie's 10th surgery, all efforts to save her life had failed, and our oncologist predicted she had about 6 months to live. As her tumors continued to grow, her whole body was racked with continuous and uncontrollable pain. No matter how much OxyContin and oxycodone she took, it provided little to no relief. Extreme nausea was resulting in dangerously rapid weight loss, and the anti-nausea medications had all failed. Marinol, a synthetic version of THC, one of the active chemicals in marijuana, was prescribed in a last-ditch effort to prolong her life. That's when these pictures were taken too. I can tell you, it simply did not work. Marinol made her dizzy and spacey and did not increase her appetite or alleviate any of the pain or other symptoms, specifically her nausea. The side effects were too severe to continue to use it. I realized then that Stephanie was not going to die from her melanoma skin cancer. Stephanie was going to die from starvation. At that point, my other adult children began begging me to let Stephanie use marijuana in my home. She had the finest doctors and hospital available here in Minnesota, and I mistakenly believed that if an illegal drug was useful, it would already be available. I was too scared, and I didn't believe it would be beneficial, so I refused. Her older brother then took her out of my home so that she could use it. When she came home 3 days later, I felt like I was witnessing a miracle. Stephanie looked better than I had seen her in over a year. She was eating again. For the first time in months, she was eating 3 meals a day and keeping the food down. And for reasons I don't know, marijuana also seemed to enhance the effects of her pain medication without making her feel high. Just a few puffs of smoke in the bathroom with the vent on periodically throughout the day was enough to relieve her suffering and give her the strength to interact and play a little with her children, talk to the family, She sat at the table for Thanksgiving and Christmas that year. Having her there was priceless to us, but especially to her 3 small children, Alexis 9, Phoenix 8, and little Jacob 2. When that doctor first suggested Stephanie use medical marijuana, my fear of being caught and my bias to its usefulness was too significant to overcome. But once I saw how much relief it provided my suffering daughter, I was willing to risk everything, including going to jail. I would rather have spent the rest of my life in prison than deny her the medicine that helped her to live 89 more days. I don't use drugs. I don't abuse alcohol. I'm a Vietnam veteran. I'm a mother, and I'm a great-grandmother. I've raised 4 children, and I'm now raising the children my daughter had to leave behind. As a lifelong volunteer, I have dedicated a large portion of my own life to people to help them stay clean and drug-free. But I saw with my own eyes that for medical purposes, marijuana works. People say that there is no greater loss than when a parent loses their child, and they're right. I lost my mother 3 weeks after my daughter, and my husband 6 months after my mother. Neither used marijuana because they didn't need it. At this point, there is nothing that can be done for me, and nothing can be done for my daughter. But there is something that can be done for those families across Minnesota that are currently dealing with similar situations to mine. We need merely to open our eyes and see their pain, even if it isn't as obvious as in Stephanie's case. The sick and dying people of Minnesota deserve compassion, dignity, and honor, and that is what this bill and passing this law will provide. Thank you very much.
Thank you very much, Ms. Whiting, and very sorry for your losses.
Thank you.
Are there any questions?
Madam Chair, I
Senator
sense the passage of time.